Every year in England, over 50,000 people are detained under the Mental Health Act. Most of them have no idea it is coming. One moment they are at home, in A&E, or on the street. The next, they are in a locked psychiatric ward, legally held against their will. The most common way this happens is called a Section 2. This is what it means. This is how it works, and this is what happens to you if it happens to you. Section 2 of the Mental Health Act 1983 is a legal order that allows a person to be admitted to a psychiatric hospital for assessment and, if necessary, treatment without their consent. It lasts for up to 28 days. It cannot be renewed. After 28 days, the person must either be discharged, admitted informally, or placed on a different section, most commonly a Section 3. The legal threshold for a Section 2 is specific. 3 conditions must all be met. First, the person is suffering from a mental disorder of a nature or degree that warrants detention in hospital for assessment. Second, detention is necessary in the interests of the person's own health or safety, or for the protection of others. Third, the person cannot be treated appropriately without being detained. All 3 must apply. It is not enough to simply be unwell. A Section 2 requires the agreement of 3 people. The first is an approved mental health professional, known as an AMAP. This is usually a social worker, but can also be a nurse, occupational therapist, or psychologist with specialist training. The AMAP coordinates the assessment and makes the application to the hospital. The second and third are 2 doctors, at least one of whom must be approved under Section 12 of the Mental Health Act, meaning they have specialist psychiatric training. In practice, this is usually a consultant psychiatrist and a GP. All 3 must agree that the criteria are met. If any one of them disagrees, the section cannot proceed. This 3-person safeguard is deliberate. Depriving someone of their liberty is a serious act. The law requires independent professional agreement before it can happen. Once the paperwork is signed, the person is conveyed to hospital, sometimes by ambulance, sometimes by police under a separate power called Section 136. On arrival at the ward, they are assessed by the nursing team. Their belongings are searched, a risk assessment is completed, an initial care plan is written. During the 28 days, the clinical team carries out a full psychiatric assessment. This includes mental state examinations, physical health checks, medication reviews, and psychological assessments. The goal is not punishment, it is stabilization and assessment. The person retains rights throughout. They have the right to appeal their detention to a mental health tribunal. They have the right to an independent mental health advocate, known as an IMAP. They have the right to be told why they have been detained, in writing, within 72 hours. Can you leave? No. During a Section 2, the person cannot leave the ward without permission from the responsible clinician. Attempting to leave is called going AWOL, absent without leave, and staff have a legal duty to return the person to hospital. Can you be treated without consent? For the first 3 months, medication for mental disorder could be given under common law if the person lacks capacity, or under the Mental Health Act if they have capacity but are refusing. After 3 months, a second opinion-appointed doctor must review the treatment plan. What happens after 28 days? 3 outcomes are possible. The person is discharged if they no longer meet the criteria, they are admitted informally if they are willing to stay voluntarily, or they are placed on a Section 3, which allows detention for up to 6 months for treatment. Section 2 is one of the most significant legal powers in mental health care. It removes a person's liberty